The next thing we'll be discussing is related to ventricular septal defect. So this is what clinical features of ventricular septal defect. So if a child has ventricular septal defect, what are the likely issues they will have? Okay, clinical features of ventricular septal defect. So ventricular septal defect presents with symptoms that vary depending on the size and defect, and amount of blood shunting, all of that. So you should just know that small ventricular septal defect may be asymptomatic, while large ones will cause a lot of complications in the individual. Okay, so in infants and young children, small ventricular septal defects are asymptomatic. They usually just dictate them occasionally, you understand. Sometimes may close on their own, you get. So why if you are having a moderate to large ventricular septal defect, the person is having all those difficulties in breathing. Okay, my life is having a lot of network issues. Alright, so if you're having a large ventricular septal defect, the person is finding it difficult to breathe. There's poor feeding, there's failure to thrive, sweating during feeds, and recurrent respiratory infections. There's also signs of congestive heart failure like hepatomegaly, edema, irritabilities, and the rest of it. So in older children and adults, there's fatigue, there's exercise intolerance, palpitations, there's delayed growth or development, okay, cyanosis in cases of Eisenmenger syndrome. Okay, there's clubbing of the hands and the toes. That's when hypoxia actually gets so intense. So physical this thing, what do they call it? Coming. So physical findings that you mostly pick up include things like all those harsh holosystolic murmurs at the lower left sternal border, and trills may be palpable on the chest. Okay, there's also signs of left or right heart enlargement depending on the shunt size. Okay, so this is what we got for the clinical features of ventricular septal defects.